Welcome to rePROs Fight Back, a podcast where we explore all things reproductive health, rights, and justice. I'm your host, Jenny Wetter, and I'll be helping you stay informed around issues like birth control, abortion, sex education, and LGBTQ issues, and much, much more. Giving you the tools you need to take action and fight back. Okay, let's dive in. Hi, rePROs. How's everybody doing? I'm your host, Jenny Wetter, and my pronouns are she, her. So, y'all, this weekend was a big weekend. It was the 50th anniversary of when Roe v. Wade was decided, and it should have been a time to celebrate, even though we know that abortion rights protected as they were protected under Roe were never enough. I mean, we've definitely talked about that a lot on the podcast, how so many people were prevented from accessing care for so long, even with abortion rights protected. But this weekend, it was, there wasn't a lot to celebrate. We are dealing with the loss of federally protected abortion rights. And that means that right now there are 14 states where you can't access an abortion. And that's, because it's been banned or almost completely banned in a number of states. You have states like North Dakota where there's no longer an abortion clinic, or you have a state like Wisconsin, where I'm from, where there was a pre-Roe ban in place, and there's a lot of uncertainty over what that means. So they're not providing abortion at the moment. But that's a lot of people that are covered in 14 states that don't have access to abortion right now. And according to the Guttmacher Institute, it's likely to be 24 states before this is all said and done. That means 24 states, almost half of the states in this country, are going to have abortion bans. Like, that is a human rights crisis and just utterly unacceptable. And thinking of all of those people who need just access to basic health care, that is so depressing, enraging, sad, like all the feels, right? I feel so many things when I think about that, of all of these people who just can't get access to basic healthcare and make their own decisions about their bodies. It is unreal. And, it just comes down to everybody deserves access to abortion, the method they want, in the way they want, in their community, and with that, whatever support they want or need. That is the world we want, right? We are dreaming of this much better future where everybody is able to access the care they need in the way they need and when they need. And it is just so infuriating that we're not there. And I am trying to not dwell and focus too much on the loss and the pain of the people who aren't able to get the care they need right now, because it's a little paralyzing. I use that as a fire to fight for the dream of the better future. And that doesn't mean we abandon the people right now, right? Like, obviously we fight to make sure that everybody is able to access care in the way they are able to right now. If that means, giving more to abortion funds to help people travel, to help people pay for their abortions. If that means, fighting to ensure that we are able to mail pills, or making sure that people are able to connect with resources they need, like the rePRO Legal Defense Fund, like all of the things. We need to do all of the things to make sure that people are able to get the care they need, while also dreaming of this much better future where everybody is able to get the care they need, the type of care they need, when they want it, where they are, right? It should be easy. It's just basic health care. It's a human right. Abortion is a human right, and we need to make sure that we are dreaming of this world where everybody is able to exercise completely their human rights, their right to bodily autonomy, their right to reproductive freedom. It is so important, and we are going to build this future. It may take a long time, but we are all committed to the work and working together and working for this future to make sure that abortion is available, accessible, and free from shame. And And we'll get there, y'all. We'll get there. And we will fight while we are building that future. We will fight for everybody now who is unable to access care to make sure that they are able to get it in a way that is helpful, right? Because we can't leave those people behind while we are building the future. It's definitely a both at once thing, but we will get there. And I'm excited when I think of that fight, when I think of that world where everybody who needs care is able to get it in the way they want and where they want and without shame. That's a beautiful future, and we will get there. And so after taking a moment and dealing with the loss again, with the loss of Ro at the 50th anniversary and sitting with that for a little bit, I am using the vision of the future to power me forward, to keep up the fight and dream of this better world, and using that as fuel to go ahead. So, when we get to, the next big milestone, we can think of all of the things we have accomplished. So, yeah, let's leave it there. And thinking about dreaming of this better world, we're going to get there. Y'all, we will. So with that, let's turn to this week's episode. I am very excited. I promised that we would talk about the FDA decision that happened a couple of weeks ago. I'm so excited to have with me today Greer Donley at the University of Pittsburgh School of Law to talk to us about what happened, what it means, what it doesn't mean, what are some of the shortcomings, what are some of the things we need to be aware of that are coming? It was a really wonderful conversation to talk through all of this to help clarify what this decision means. So with that, let's go to my interview with Greer. Hi, Greer. Thank you so much for being here today.
Thanks for having me.
Before we get started, do you want to take a quick second and introduce yourself and include your pronouns?
Sure. My name is Greer Donley, she, her, and I'm an associate professor at the University of Pittsburgh School of Law.
I'm so excited to have you here today. One, we're talking about some good news. I mean, we'll talk about the caveats as we talk, but I feel like it's nice to be able to celebrate any victories right now. So,
absolutely.
But I guess before we get to what the FDA did, maybe we should do a little bit of background and talk about what were some of the restrictions around medication abortion or challenges to getting access to medication abortion before this new change.
Yeah. So one thing that's so important for people to understand is that ever since the FDA approved mifepristone in 2000, so, for those of you who don't know, medication abortion in the United States in particular is usually done with two different drugs. The first one is mifepristone. The second one is misoprostol. And only the first of those two drugs, Miffy, is actually approved to terminate a pregnancy. And partly because of that, because of its particular approval for abortion, it has always been regulated extremely harshly by the FDA. So the FDA approved the drug in 2000, but ever since it approved the drug, it has really limited and strictly limited how people can access it. So typically with the FDA, if it approves a drug, any licensed healthcare provider has the ability to prescribe it, and then they call it into your pharmacy, right? I mean, we all kind of know how this works with prescription drugs, but that's not true with mifepristone. And so, now the kind of modern way that the FDA has regulated mifepristone is through what's known as a REMS, which is a particular protocol that is only supposed to be used for highly risky drugs, for drugs that cannot be safe and effective without distribution limitations. For about 5 or more years, every major medical association and every expert in the field has said that is completely unnecessary because mifepristone is one of the most studied drugs on the planet. It's extremely safe. It's safer than penicillin and Viagra, two drugs that are on the market without any sort of distribution limitations. But nevertheless, the FDA has continued to impose a REMS. It has the recent news that came out a few weeks ago was just a modification of the requirements that it has imposed on this drug.
So it required you had to go in person, and that was one of the first things that got modified temporarily during the pandemic, which helped expand some access, but it was definitely not far enough, but it was a good step during the pandemic.
Absolutely. Previously the FDA had required that people go in person to pick up the drug, which is highly unusual, right? That required, for instance, that pharmacies could not dispense at all. And it really basically subjected medication abortion to all the same burdens and logistics and financial hassles of procedural abortion, because even though people are just picking up a drug, right? They had to travel to a clinic, and clinics were few and far between in many states. So this was, actually quite a huge deterrent on abortion access. But of course, in the middle of the COVID-19 pandemic, not only was it a deterrent on abortion access, it was also a big problem just generally for COVID transmission, because the FDA was essentially forcing people to go in person and subject themselves to, transmission risks for no safety benefit. That's when the in-person dispensing requirement, which was one element of the mifepristone REMS, started really coming under attack. And part of that was because under the Trump administration, the Trump administration FDA was releasing many of these in-person requirements for other drugs, but refused to do so with mifepristone. So this led to a lawsuit, in 2000, I think it was in the summer of 2019, that the District of Maryland created an injunction saying, no, the in-person dispensing requirement is temporarily suspended for the duration of the pandemic. The Supreme Court overturned that decision, but then Biden won the presidency, and under his leadership and with a new FDA commissioner, the FDA announced that it was going to not enforce the in-person dispensing requirement for the duration of the pandemic. So that happened in in December 2021. The FDA also announced, hey, we're going to actually get rid of this requirement completely. Once the pandemic's over, we're going to get rid of this requirement, because it turns out that we have incredible public health researchers that were doing research at the time showing, what we knew already, that the requirement was totally unnecessary for public health purposes. What happened 2 weeks ago was that the FDA was formalizing, what it had announced, 14 months prior. Or 13 months prior. And so in doing so, it kind of laid out what this was going to look like, saying, we're going to get rid of the in-person dispensing requirement. You guys already knew that, but now we're allowing pharmacies to dispense, but not all pharmacies, just some pharmacies that become certified. And we're going to tell you what that certification looks like.
So, it's one of those things that's like, it's really good news for the places where it is going to expand access, but there are so many places where that's not going to be the case, right? Like isn't going to affect all of the states where abortion is already banned. They're not going to be able to benefit from this expanded access. So it was one of those like good news, but really kind of not as good of news as everybody would have hoped. Can we maybe talk a little bit about why this is not enough?
Absolutely. So, I think the most important thing to note is that, some of the headlines were like, FDA allows pharmacies to dispense, right? First of all, the only reason why pharmacies can't dispense to begin with is that the FDA has been preventing them from doing so ever since the drug was approved. Advocates have been arguing for, more than 5 years that all of these REMS requirements, of which pharmacy certification is one of them, should have been gone, right? This is a safe and effective drug. Why are we over-regulating it? And nevertheless, the agency refused to get rid of the REMS. The fact that the agency is not letting any pharmacy dispense this drug and is instead forcing pharmacies to go through the hoops of getting certified, that those hoops are not nothing, is kind of problematic. So I think, we should all be really careful before we start, praising the FDA right now, because the FDA, this is certainly incremental change in the right direction, but it is not some sort of massive victory. So it's not a massive victory because, the FDA could have removed the whole REMS, but it's also not a massive victory because of what you already alluded to, which is that it's not going to have any effect in the states that ban abortion, because even if the federal government is saying, hey, pharmacies can dispense this drug, there are state laws that apply that are going to stop pharmacies and prescribers from, doing anything with MIFI for abortion. And also, even in the states that permit abortion, you need pharmacy involvement, right? One of the problems with a lot of the headlines is that I think there's going to be a ton of misinformation out there about people thinking that they can go and pick up medication abortion right now. Well, no one can get it right now, right? The pharmacies are in the process of exploring if and how and which ones are going to become certified. That's going to take time. They're going to have to go through these kind of hoops that the FDA has required for certification. And then once they do, we actually don't yet know how many pharmacies, like branches, are actually going to dispense the drug. We already know that there is the first, big, massive protest and boycott that's being planned for these pharmacies coming up. And so, that could be a deterrent for pharmacies that are actually might start walking back what they decide that they're going to do here. So it's one of those things where we need pharmacy involvement, and we still don't have a ton of information yet about what that's going to look like. And then once pharmacies do become certified, you still have to, it's not like we're talking about over-the-counter types of rules here, right? You still are going to have to find a certified provider. That's another one of the FDA's REMS requirements that can write you a prescription for the drug. All these, everyone, if the pharmacies are going to have to follow all the state abortion laws in the state, this is still going to be a very highly regulated drug, much more regulated than average drugs on the market. And so, all of those things really impede access, and they impede access for a time-sensitive abortion is a time-sensitive healthcare intervention. And, again, the safety and efficacy data suggests that they shouldn't, these extra regulations are unnecessary.
This takes me back to the days when you had to get a prescription for Plan B, and you had to find the pharmacy that would fill it, because there was this mix of maybe they weren't stocking it, maybe you were having to deal with pharmacist refusals. It just is flashing me back to that world of you have this prescription for this time sensitive thing, and you had to try to find somewhere where you could get it filled. And often you would just hear stories of people not being able to find one or having to travel great distances. And I'm just kind of this all brought me right back to those conversations.
And it's such a good analogy because that's, Plant B is just another example of a drug that was overregulated by the FDA. And actually, there were court interventions that were required over the course of 7 years to finally get the agency to act according to its scientific mission and provide the drug over the counter. And so it's a great analogy. And it's also worth noting, and one thing that people may not realize is that over the last few years, since the COVID pandemic started, there has been a few online pharmacies that have been dispensing mifepristone. The most famous one is one called Honeybee Health, which works with a lot of the virtual clinics like Hey Jane and Choice. And so, for many people, they were already getting this drug dispensed through Honeybee Health that was sent directly to their home. So, again, it's, when we talk about access, you have to kind of think, well, how is this really radically going to change anything? I think one of the biggest wins here is for abortion stigma, because I think it just says something important to be able to pick up this drug at your average pharmacy where everything else is, right? I think that's really important. I think it's really important that you see such big chains saying, no, this is healthcare, we're going to dispense this drug. I think that stuff really matters. But in terms of actual access and people being able to get this medication more quickly or easily, I think it's really, the jury's still out on that. And if it's true that brick and mortar pharmacies do start offering it, it is possible that people will be able to get the drug a little bit quicker than the mail pharmacies. But some people are going to say, you know what, I would actually prefer to have, a drug like this that's, maybe I don't want someone else knowing I'm having an abortion, to be dispensed from a a mail pharmacy directly to my home in a private package, right? So it's just really important to remember that there were alternatives on the market already, and some people are going to continue to prefer those.
Yeah, for sure. As somebody who is from small town Wisconsin originally, like I can definitely appreciate the like convenience and like not having everybody in your business of having it mailed to you. I think the next thing that is lurking that I think is maybe not on a lot of people's radars because there's been so much abortion news and it's hard to keep up with like all of the attacks that are happening is this legal challenge that is working its way through the system right now as an attempt to ban mifepristone. Do we want to touch a little bit on that and what that could mean?
Yes, it's so important, and I'm glad we're talking about it because, I think most people are not super familiar with this lawsuit, and it's a lawsuit that is potentially likely to cause tremendous chaos coming up soon. So, basically, an anti-abortion group sued in Texas, sued the FDA in Texas, saying that the FDA never should have approved mifepristone to begin with, challenging kind of the authority under which the FDA approved this drug, also trying to revive what's known as the Comstock Act. This was an act that was passed like almost 150 years ago that bans a lot of things, but as part of it, it bans mailing abortion pills. So this lawsuit is meritless, it's frivolous, but, and it's a huge
But
it was filed in a district court where the only judges are anti-abortion Trump appointees, and we have real reasons to be concerned that the judges are not going to give this a fair shake, and that they're going to kind of just rubber stamp anything the anti-abortion movement wants. So, we could be facing a world in which, within the month, we have an injunction from a district court, potentially a nationwide injunction from a district court in Texas saying that, the manufacturers of mifepristone can no longer sell or promote their product, essentially removing it from the market. So this is like something that is very serious because this would affect abortion nationwide. More than 50% of abortions in this country now occur through medication. And because Dobbs has been so disruptive of the abortion market and forced brick and mortar clinics to be totally overwhelmed, it's so important to have medication abortion as a way of releasing some of that pressure on the brick and mortar clinics, because you have virtual clinics that have stepped up and really provided a lot of services to people. What happens when medication abortion is not an option in this country? Well, it's really bad because a lot of abortion providers are only trained to provide medication abortion. We don't have the space at clinics to accommodate all of the abortion patients in the country going to, only brick and mortar clinics in half of the states that now permit it, doing procedural abortions all the time. It's going to be seriously problematic. Abortion's a time sensitive procedure. What happens when people can't get in for months, right? That's a really serious problem. I do want to say, however, that there are some solutions. One of the most important ones, I think, is that, this lawsuit, depending on the theory the judge goes with, could only affect Miffy. And so misoprostol could still be on the market, and across the country or across the world, miso is used on its own to terminate pregnancies. And, generally it's considered to be a little bit less effective, but more modern research is showing that if you give it at higher doses or give extra doses out at times, that it can be quite effective. So, I think that that's not to downplay how disruptive a potential injunction in this case could be, but just to prepare people for, kind of changing norms and how we do medication abortion in this country.
yeah, and I would just mention that both forms of doing medication abortion are WHO approved protocols, so it's not like this would be something out of the ordinary. It is very common around the world. It is one of the WHO approved protocols. That doesn't, like you said, that doesn't mean it's not couldn't be very disruptive. And just thinking of like how swamped and overwhelmed the system is already, dealing with the disruption caused by Dobbs, like this could just take the chaos that's already happening and just make it much worse.
Absolutely. And one thing I have been saying for like over a year at this point is no one should feel safe right now. Right. And I think there's probably a lot of people in New York and California who, think, well, I'm safe. Right. I'm going to be okay. But you're not. Like the truth is, like your clinics are going to get just as overwhelmed, right? This is the anti-abortion movement is coming for everyone. They want to end abortion everywhere. And if this is successful, then the disruptions that are caused will affect people across the country. And the New Yorkers are going to be really surprised when they need an abortion and find out that they can't get in either for a month, or that they have to travel to Maine to find a provider in the next few weeks or something like that.
Yeah, I think there's that like comfort of thinking I'm somewhere where it's not going to be impacted, and not quite seeing how having people having to travel to your state means it's going to impact your care. It's going to impact everybody.
Yeah.
Okay, let's turn to solutions. That's enough of like everything is terrible and it could get worse, because that's a lot right now. What needs to happen to help protect access or expand access right now?
There are a lot, I will say that there are a lot of innovative strategies that people in the movement are talking about. And, states, I think at this point are interested in innovating in interesting ways. I'll start with the federal government. I don't have a ton of faith, to be honest, that we're going to see many of the radical changes that we actually really need. For instance, removing the entire mifepristone REMS, and other things that the FDA could do to potentially make medication abortion much more accessible. But, one thing to always remember is that the federal government actually does have a lot of power right now, and we should be pressuring the Biden administration to do more. It can do more, and we should continue to, we shouldn't accept the scraps, right? We shouldn't say, thanks for pharmacy dispensation, we're done. No, like that was truly not a huge thing for them to do. So like we need to demand more. With that said, I think the much bigger things we're going to probably start seeing is in the state laws. So I'm working on a paper right now with David Cohen and Rachel Ray Boucher about some of the innovations coming down the pike here. But, we explore the possibility of states following Massachusetts' lead to try to shield providers who want to ship pills into red states via, telehealth and mailing medication abortion. We talk about states that are interested in considering pharmacist prescribing of medication abortion. So what would that look like if a patient never needs to go see an abortion provider at all? They could just show up to their pharmacy. The pharmacist could prescribe and dispense the drugs at one time. That's true in many states for a lot of medications. Actually, it's becoming an increasingly common model. So why we use that? It's actually a model that's been adopted by many states for birth control. So maybe we should consider doing that for medication abortion. There's also the possibility of missed period pills and advanced provision of medication abortion as a way of potentially circumventing abortion bans. And then, finally, there's just like the informal networks that are operating right now all the time that are getting pills to people who need them from other countries. Obviously we have aid access, but there are much less formal mechanisms to people who are getting pills in from Mexico and getting them into the hands of people who need them.
Yeah, and I think it's just worth also flagging that the Department of Justice also took action or announced around the same time. It might have been the same day. I don't remember. It all is blurry. That um, mailing medication abortion pills was not something that they were going to pursue. That was allowed, even if you were mailing him to a state where it was banned.
And I'd love to just elaborate on that briefly.
Yeah.
There was so much misinformation about that in the press as well. Just to say that, that was a really important federal interpretation of law. And the law that they were interpreting was the Comstock Act, which is I brought up at the beginning. So the one thing I do want to say is that there were a lot of takes about how this means it's completely legal to mill pills in all 50 states. And I just want to note that, this was an interpretation of one federal law. So that does not mean that state laws necessarily permit mailing pills. And so, just a caveat I want to mention on that, this is, and also that this is just the federal government's interpretation of its own law. The courts are really the constitutional entity that are charged with interpreting the law. So the courts could choose to not accept that interpretation, right? And this is now, Comstock is going to be the subject of litigation. And, the courts might find differently.
Yeah, I think this comes back to like the continual conversation of like your risk now is like legal risk versus like worrying about taking unsafe medication.
Yeah, I think that's right.
Okay, so I want to be aware of your time. Let's wrap it up with a final question we always ask. And this right now, what can our audience do? What kind of action can our audience take?
There's always the basic things, right? If you live in a blue state, you have, pressuring your legislators to be innovating and passing, radical legislation right now is extremely important. We are going to be entering a phase where the anti-abortion movement is trying everything they can to stop abortion pills. We're going to see them pass all sorts of laws that are crazy. Some of them will be blatantly unconstitutional. I'm not suggesting that we should necessarily pass unconstitutional laws, but I am suggesting that this is the time to be creative and innovative in our movement too. And so if you live in a blue state, this is something that you can really care about. New York right now is considering a law that would allow, that would shield providers who want to ship pills into red states. It's a really important way to try to secure access and get access to folks who can't travel, who don't have the money or the capacity to leave the state. So, get involved statewide, like we think about politics a lot of times nationally, but the state and local stuff is really important right now. Continue to pressure, right, the federal government as well. And other than that, I think we all just need to be prepared for a lot of chaos and confusion that's going to start coming in the next year, and to be open to new models of care. I think the meso-only abortions is something that a lot of people would not have been comfortable with a year ago. But things are changing, and like that might have not, that might have not always been the right call. Like this is a time when perhaps we need to start thinking and being willing to do things in a slightly different way.
Well, Greer, thank you so much for being here today. I had a wonderful time talking to you.
Ditto. Thanks for having me.
Okay, y'all. I hope you enjoyed my conversation with Greer. Like I said, I had a wonderful time talking to her. It was great to hear some of the, it was good news, but to hear it tempered with, there are definitely real challenges ahead and that this doesn't fix all the things. I think that's important to be aware of. I think sometimes that gets lost in headlines and other things that we don't hear some of the granular detail that we need to really think through. So with that, if you have any questions or comments or want to talk to me, always feel free to shoot me an email at Jennie, JENNIE, at reprosfightback.com. Or you could reach out to us anytime on social media. We're at rePROs Fight Back on Facebook and Twitter, or rePROs FB on Instagram. And with that, I will see you all in 2 weeks. Bye! For more information, including show notes from this episode and previous episodes, please visit us at our website at reprosfightback.com. You can also find us on Facebook and Twitter at rePROs Fight Back and on Instagram at rePROs FB. If you like our show, please help others find it by sharing it with your friends, and please rate and review us on Apple Podcasts. Thanks for listening.